what is the basic thesis here in terms of how the model of the NHS, in your view, might have changed under the coalition, might have still delivered universal healthcare, free at the point of use, but under a very different model?
Well, the starting point for this article was simply the observation that a lot of our neighbour countries are facing the same challenges. They've also gone through COVID. They've also had a bad flu season and all the rest of it. They also have a grim winter in parts, but they don't have the problems that we have here. And that's simply because they have better healthcare systems. And I was asked to comment on the current winter crisis, what could be done about it. And I've always said I can't really comment on that. It's not that I have any ideas for a quick fix. It's more of a I wouldn't start from here. That's my position. So then I was asked, well, where would you start? And therefore I started outlining where I would start from, ideally in the past.
It's absolutely fascinating to read, particularly the early part of this. You sort of say, well, in this alternative history, Cameron didn't really know what his policy ideas was. He commissions this sort of review run by one of Obama's people, and it ends up recommending that we take on the Dutch system of healthcare, or something very similar to it.
Yes, and that's because that person, even though this is a fictitious report, that person actually exists, that former Obama advisor. He has written a book about, I think, 2 years ago, where he, I think it's literally called which healthcare system is the best in the world, something like that. And he does come to the conclusion, he doesn't want to say this one or that one, doesn't want to nominate a single one, but he has a top tier, and the Netherlands are very much in that. And I thought, well, okay, that's a country which spends about the same amount on healthcare as Britain does, far better outcomes, quite comparable in other ways. Therefore, would it really be such a radical thought experiment to say, well, what if we had a healthcare system like they have?
And it's fascinating, you sort of go through the political machinations of what would have happened. The Deputy Prime Minister at the time, Nick Clegg, being half Dutch himself, sort of wrapping himself in a Dutch flag, saying, look, it's almost xenophobic if you oppose the Dutch system of healthcare. It's quite a comedic piece. But there are always these people that say that really what you're trying to do is Americanise the system, no matter what you propose happens to it.
Yes.
And how did that play out in your thought experiments?
Well, yeah, that's why you have to emphasise that if you're talking about an insurance-based system, a social insurance system, universal private insurance system, whatever you want to call it, you have to emphasize that this already exists. It's not some radical idea that some think tank nerd has come up with. It does exist in a number of countries, the Netherlands being perhaps a particularly good example, not the only one, but certainly a starting point. And that's the part that you have to emphasize. Under different circumstances, I would say, let's not make it too much about the specifics of this country or that country. Let's just talk about what kind of health system we want to have. It's just that when you talk about alternatives to the NHS, your opponents will always say, oh, you want a system like in the US. Do you know how many people face medical bankruptcies and all that? And it's just a lot easier if you can point out there are no medical bankruptcies in the Netherlands. Doesn't exist there. They don't have an uninsured population. And by just pointing out that kind of system, it's not a super radical idea. It does exist. It has good outcomes. And that's why I emphasized that point in the article.
At a very basic level, in the Netherlands, what happens is if you don't earn a lot of money, the government pays for your healthcare. If you do earn a lot of money, you sort of get your own insurance out. That's basically the system.
Well, yeah, everyone has private insurance and you're obliged to get it. It's just that if you can't afford to pay your premium, then the government will pay it for you. But nonetheless, you would be with the same health insurer as your rich neighbour. It's not that there's a rich people's luxury health insurer and a poor people's Ryanair insurance. No, they would all offer roughly the same standard, and it's just that some people pay their own premium, namely those who can, those who the majority of the population can afford to pay their premiums, but some can't, and in those cases it's going to be paid for them. And the health insurers cannot discriminate on the basis of risk status, on the basis of your individual health status. They can't say, oh no, you're too risky because you have these pre-existing conditions or something. They have to accept you.